It's brought in a group of practice champions who have different sets of skills, and they've enabled us to introduce different activities to the patients, different groups, workshops, and basically just bring a difference to the practice, just rather than here's your prescription or booking an appointment to see the doctor. It's a lot more patient involved and good.
I think the work we've done with the champions is just different. We're able to do things that we would love to do, but we've not got the manpower all the time. So we're able to implement innovative ideas through their goodwill and them gifting their time to us.
My role, because I work on reception a little bit, has been mainly signposting people to all the different activities we have. And because you get used to seeing patients coming in and you sort of grow with them over the years, you can tell when they're becoming lonely or depressed. And at this point, it seems a good point, if they're lonely, to say, well, why don't you come along and sing, or why don't you come along and walk? And we've signposted quite a few people, and it has made a difference to them.
So it is a collaboration of everyone in the team. Kay leads on the work. I'm quite keen on getting clinical outcomes. So we've had the veg on prescription, where they go and grow food and eat food and socialise together. So I was really keen to see if it had any impact on their well-being. So work with the various networks that we're working with on pre-questionnaires, post-questionnaires, and even looking at baseline observations, just to get something, because we know that it's beneficial, but just to get something documented to back that up.
It's made a big difference because it's another perspective rather than just the medical, clerical, admin work that we do. It's involving other people, and it's brought a lot more social, and people have made friends that people you wouldn't normally speak to. So there's a lot of friendships come from it, and I think a lot of loneliness in the people who've joined. They've got new groups of friends now that they actually socialise with apart from the practice activities. So it's done really good.
I think the champions are an extension of us, and they're a great support mechanism. So the whole of the work that they do is just, you think, you know that they're doing it and they're contributing massively. And if we didn't have them, we wouldn't have time to do it. They're ringing patients who are lonely and isolated. That's having massive impact, and they're definitely reducing appointments, because a lot of cohort of people who we know would come in for appointments for vague symptoms, maybe because they're lonely, has dramatically reduced.
It's involved me having to go for a walk every Wednesday with the patients. There's one lady who comes with us, she has a walking frame and she's not quite up to the full work, so I'm the nominee wheelchair pusher. So we take that just in case she gets tired when we go in. We've been roped into the singing and just all the activities, promoting everything. It's been really good fun. It's enabled us to do a lot more than they were doing, a lot more social activities, and giving people more than just a prescription. And a time for a doctor's appointment. People aren't coming in as much to the doctors because they're doing the other activities, they're not as low. Or sometimes they'll just ring up and you just chat to them, and it makes a difference to them. We have the champions coming in who have a list that they work through of housebound patients, and they just ring them just to see if they need anything, and sometimes it's just a chat that people need, and that makes a massive difference.